Global temperatures are rising, making extreme heat events more frequent and intense. Heat waves pose significant health risks, especially for vulnerable populations. Extreme heat can lead to various heat-related illnesses, from mild discomfort to life-threatening conditions. The elderly, children, and those with chronic health conditions are particularly susceptible. Heat waves can exacerbate existing health problems like heart disease and respiratory illnesses. It's important to be prepared and take precautions to minimize the impact of extreme heat on your health. Staying informed and following expert advice can help you navigate these challenging weather events. The information provided here is for general knowledge and does not constitute medical advice. Consult with a qualified healthcare professional for any health concerns or before making health-related decisions. High temperatures strain the body's ability to regulate its internal temperature. The body works harder to cool itself down, which can lead to various health issues. Prolonged exposure to high temperatures can disrupt the body's natural cooling mechanisms. Sweating is the body's primary cooling mechanism, but in extreme heat, it may not be enough. Dehydration can further reduce the body's ability to sweat effectively. Heat-related illnesses range from mild heat cramps to severe conditions like heat exhaustion and heat stroke. Recognizing the symptoms of these illnesses is crucial for timely intervention. When the body's core temperature rises significantly, it can damage vital organs. Therefore, it's essential to take precautions to avoid overheating and seek medical attention if needed. Staying hydrated, wearing appropriate clothing, and seeking cool environments are crucial for prevention. Recognizing the symptoms of heat-related illnesses is vital for taking prompt action. Heat exhaustion, characterized by heavy sweating, dizziness and nausea, requires immediate cooling measures. Heat stroke, a more severe condition, manifests as a high body temperature, confusion and loss of consciousness. Vulnerable groups, including the elderly, young children and individuals with chronic illnesses, are particularly susceptible. Symptoms of heat exhaustion include heavy sweating, weakness, dizziness, headache, nausea, and muscle cramps. If you experience these symptoms, move to a cool place, drink fluids, and rest. Early intervention is crucial in preventing heat exhaustion from progressing to heat stroke. Heat stroke requires immediate medical assistance. If you suspect someone is experiencing heat stroke, call emergency services and take steps to cool them down. Prompt action can save lives. Staying hydrated is paramount during extreme heat. Water is essential for regulating body temperature and preventing dehydration. The World Health Organization recommends drinking plenty of fluids, even before feeling thirsty. Dehydration can lead to symptoms like dizziness, headache, fatigue, and muscle cramps. Monitoring your urine color can be a good indicator of hydration status. The World Health Organization recommends drinking at least 2 liters of water per day, especially during hot weather. Avoid sugary drinks and excessive caffeine, as these can dehydrate you further. Electrolyte drinks can help replenish electrolytes lost through sweating. Fruits and vegetables with high water content can also contribute to your daily fluid intake. Staying hydrated is a simple yet effective way to protect yourself from the harmful effects of extreme heat. Dressing for the heat, staying cool and comfortable. Wear light-colored, loose-fitting clothing made of breathable fabrics like cotton or linen. Light colors reflect sunlight, while loose-fitting garments allow for better air circulation. Avoid tight-fitting clothing, as it can trap heat and increase body temperature. Natural fibers like cotton and linen are breathable and allow sweat to evaporate. Consider wearing a wide-brimmed hat to protect your head and face from the sun. When choosing clothing for hot weather, prioritize comfort and breathability. Using breathable bed linens can improve your comfort during hot nights. Choose sheets and pillowcases made of natural fibers like cotton or linen. Staying cool and comfortable during hot weather can significantly improve your overall well-being. Additional cooling strategies for beating the heat. Beyond hydration and clothing choices, several other strategies can help you stay cool. Taking cool showers or baths can provide immediate relief. Applying cool, damp cloths to your forehead, neck and wrists can help lower your body temperature. If you don't have air conditioning, visit public places with air conditioning, such as libraries or shopping malls. During heat waves, many communities open cooling centres for relief. Creating a cross breeze by opening windows on opposite sides of your home can help circulate air. Avoid using the stove or oven during the hottest part of the day. Consider wetting light clothing and wearing it for an evaporative cooling effect. Staying cool during extreme heat requires a combination of strategies tailored to your needs. Community care looking out for vulnerable neighbours. Checking in on elderly or vulnerable neighbours during extreme heat is crucial. These individuals may need assistance staying cool and hydrated. Offer to help with errands or provide transportation to cooling centres if needed. Ensure that vulnerable neighbours have access to cool spaces within their homes. Encourage them to drink plenty of fluids and stay hydrated. If you notice any signs of heat-related illness in a neighbour, take immediate action. Help them move to a cool place, offer fluids, and contact emergency services if necessary. Being a good neighbour can be life-saving during extreme heat events. Community support is essential for protecting vulnerable populations during heat waves. Protecting infants and children from extreme heat. Infants and children are particularly vulnerable due to their smaller body size. Dress them in light-coloured, loose-fitting clothing and avoid overdressing. Never leave infants or children unattended in parked cars. Ensure adequate ventilation when using a stroller. Keep them hydrated by offering frequent sips of water or breast milk. Monitor infants and children closely for signs of heat-related illness. Plan outdoor activities during the cooler parts of the day. Seek shade whenever possible and limit sun exposure. Protecting infants and children from extreme heat requires vigilance and proactive measures. Minimizing sun exposure, shade and protective clothing. Seek shade whenever possible, especially during the hottest part of the day. Trees, umbrellas and other forms of shade can provide significant protection. Wear protective clothing, including a wide-brimmed hat, sunglasses and long-sleeve shirts. Choose light-coloured clothing to reflect sunlight and keep you cooler. Apply sunscreen with an SPF of 30 or higher to all exposed skin. Reapply sunscreen every 2 hours or more often if you're sweating or swimming. Avoid direct sun exposure during peak hours, typically between 10 a.m. and 4 p.m. If you must be outdoors during these times, take frequent breaks in the shade. Protecting yourself from the sun is crucial for staying safe and healthy during hot weather. Keeping your home cool during heat waves. Close curtains or blinds during the day to block out sunlight. Use fans to circulate air and create a cooling breeze. Placing a bowl of ice water in front of a fan can create a cooling mist. If you have air conditioning, use it strategically to cool down your home. Set the thermostat to a comfortable temperature and avoid overcooling. If you don't have air conditioning, consider spending time in air-conditioned public spaces. Staying cool during extreme heat is essential for protecting your health. Staying safe in extreme heat. A summary of essential tips. Stay hydrated by drinking plenty of fluids, even before you feel thirsty. Wear light-coloured, loose-fitting clothing and seek shade whenever possible. Monitor yourself and others for signs of heat-related illness. Take cool showers or baths. Apply cool compresses and use fans to stay cool. Check in on vulnerable neighbours and offer assistance. Protect infants and children from extreme heat by taking extra precautions. Minimize sun exposure and wear protective clothing. Keep your home cool by closing curtains, using fans, and utilizing air conditioning strategically. By following these steps, you can significantly reduce your risk of heat-related illnesses and stay safe during extreme heat events.